My name is Alice Bridges.
My name is Angelia Darty.
My name is Diana Hart.
My name is Madison. I'm a PCA at a children's hospital.
Was wanting to be sure that I could maintain my active lifestyle and was not really having a lot of significant pain with my bunion. However, it was progressing and I really felt like there was the potential for it to become irreversible. And so I made the decision to work with Dr. Kim to get that corrected through a bunionectomy about a year and a month ago.
I have had trouble with my feet for a very long time, and I had a surgery. It's been, 30-something maybe years ago, and when I had it done for a bunion on my right foot, it was terrible. It was the awfulest, painfulest, worst surgery I ever had. It just bent right back over. The bunion came right back. It was a nightmare. So I was trying to, figure out what to do, and I found him online, and I was like, okay, that's where I'm going.
I found Dr. Kim through my aunt who used to work with him, knew him pretty well, and she had seen the bunion on my foot and was like, it is time to get it looked at, and knew the right person to go to, so that's how I found him.
We have a family history of this bunion issue. My mother, in I think the late 80s, had this procedure. I watched her go through the procedure. I was her caregiver. I was horrified that I knew one day I would have to do this. Over the years, I visited several different physicians, and I was told what the procedure was gonna be, and that I would never wear heels again. And as a model, not what you wanna hear. So I took a step back, but then the pain was persistent with shoes, without shoes, walking, sleeping, and I said, I've got to do something.
So during my training 15 years ago, LapiLock didn't exist. It wasn't on the market. The typical and traditional way of doing a Lapidus, and by the way, a Lapidus has been around for nearly 100 years, technically over 100 years since it was originally described. So it's not a new procedure, but the way of stabilizing it is new. And the way that we use this external outrigger or jig really allows for precise correction. And that's exactly what this does. It gives you an extra set of hands as a surgeon to get that position, to restore the alignment perfectly in all three planes, and that's what we're trying to achieve. So it's dialed in, so it stays in that alignment as it heals, and it's not gonna fall apart. So I love that the LapiLock tray has a complete option of screw sizes and diameters. I can be bicortical with my fixation on every screw, because my goal is stability.
Oh, it's been wonderful. Are you kidding? I can walk, I can even run a little bit if I want to. I can get in the floor and get up, I can wear shoes I've never been able to wear. And I have like I said, I don't have any pain, I don't have any numbness, I don't have any swelling, nothing.
Yes, the procedure smoothly. It was outpatient surgery where I went home. After the procedure, I was able to bear weight, take the boot off, and be out and about and start to get my, mobility and strength and all of that back. And within several months after that, pretty much back to normal.
Great. I haven't had any problems with it at all, but that's about it. I can walk around in shoes. I work 12-hour shifts often in rows. I don't have any issue at all. I can run around for the whole 12 and be fine. Yeah, I really don't have any issues at all.
Oh, wow. Well, since it's changed, I have no pain. My shoes fit amazing. I'm able to do things I haven't been able to do in a long period of time, standing on my feet for long periods of time. I'm dancing again. That's something I haven't done in a long time because that used to be challenging to dance for long periods. I'm wearing heels again without pain. So a lot of great things. And I even went to the beach after my surgery and wore flip-flops for the first time since I was a child. So that was huge. I mean, that was really huge for me that was fixed. Yeah. So it was an amazing moment for me.
That is awesome.
So I'm not limited in the fixation options with the LapiLock system. I can use staples, I can use screws, I can use a plate and screw. I can use whatever combination of fixation is best for that patient. And my goal is stability. And if I provide stability to the dialed-in correction, I can allow that patient to walk sooner. So I don't need to do a splint for 6 weeks and stabilize the patient with a cast, for example. At this point, I'm so comfortable and confident in the system, I'm allowing patients to weight bear day one, typically. Ultimately, the success for these patients has been undeniably great and better than anything I've seen with other systems in the past. So the proof's in the pudding.
Considering the first procedure I had, and then looking at the one that I've had today, there is no way that I would ever do that again versus what I got done today. I can tell you that because the difference is just incredible. It's like, you know, you don't feel all that pain. Like I felt the pinching and the pulling and the screws and, right from day one when, even if I wasn't walking on it. And the leg would swell up and it'd be terrible pain. And so now the procedure was different. I was off my foot, but I didn't have all of that pain. I didn't have all that swelling right at the beginning. When I was able to start walking on the boot, it was like, oh, wow. Yeah. Whereas before it was like, oh, if I tried to get up, I was terrible.
100%, I would 100% recommend getting it. It was not, in 3 months I was on a vacation, jumping off rocks and climbing and doing things I really don't know that. But in 3 months I was doing great. I was walking around in long periods of time throughout the day. didn't have really any discomfort. I would 100% recommend it. It was less pain after than it was before.
So I actually have already referred a couple of people to have this procedure done, and one of them just had it completed. And I explained the same process, that he's caring. The process is easy. Recovery was amazing. To be walking again in 2 weeks after having such a serious procedure done, and considering all of the things that were done with the plates and screws, is amazing. To be walking and then in a shoe in 6 weeks was incredible. So just kind of giving them that level of confidence of my personal experience and how it went for me, and then them seeing me walk around and with no pain and no discomfort, I think, was the seller for them, and they went and had the procedure done, and they're now in walking shoes also.
I'm doing these almost as quickly as I was Austin's 5 years ago. The Lapidus is turning into my main workhorse for these procedures due to the success rate, due to the lack of non-unions, due to the lack of painful hardware. The fixation's made for this anatomy. I haven't had a problem with non-unions or irritation. Patients are walking about immediately in their post-op boot, and they're very satisfied. So if you feel that you're losing correction, we think about the construct. Maximize stability. The options are there to do that with the LapiLock system.